All right. Okay, good afternoon, everybody, and a very warm welcome to this noon meeting hosted by the Health Policy and Systems Division here in the School of Public Health. And we are particularly pleased to welcome our colleagues from Priceless. Priceless, as many of you would know, is a South African Medical Research Center WITS center collaboration for health economics and decision science. And this research to policy unit provides evidence, methodologies, and tools for effective decision making in health. And Priceless has been very much at the forefront of I think quite cutting edge research related to the the commercial determinants of health in particular, and had released last year, in fact, a very, I think, insightful special issue around sugar sweetened beverages and the current status of legislation and policy around that in several different African countries. So before I introduce the colleagues individually, just to explain a little bit of the background to this particular presentation. So in the Health Policy and Systems Division, as well as the HPALs, that's the Human Physical Activity and Life Science unit within the Human Biology Department, we, together with colleagues from Priceless and colleagues from several other low and middle income countries, Brazil, Jamaica, Kenya, Cameroon, Nigeria, and in partnership with Cambridge University, had been involved in a research network called GDA, standing for Global Diet and Activity Research Network. And in this network, we focused particularly on looking at diet and physical activity as two key determinants of non-communicable diseases, or NCDs for short, and doing several pieces of work to try and see how to promote healthy food and physical activity environments, particularly in urban contexts and particularly in poor income settings in those urban contexts, low income settings in those urban contexts. And in the last 2 or 3 years of our work, we've also looked at the intersection between these determinants and climate change. It's a very, very big research agenda that we've been working on and just really scratching the surface. So we are one of very, very many contributors that are working towards seeing how to mitigate against this growing burden of non-communicable diseases in Africa and other low and middle income countries in particular. And so, as our work had gone along, in the early years, I think the narrative was very much focused on individual choice, and that it was individual behavior regarded as driving the epidemic of overweight and obesity and NCDs. But I think with the onset of the SDGs in particular, there's been a growing realization of the very, very significant impact of the structural determinants of non-communicable diseases. And among those structural determinants are the aspects that relate to commercial determinants of health, amongst many other factors that influence access of people to healthy food and physical activity environments. So this work around front of package labeling, which our colleagues will be presenting on this morning, is one of several different kinds of interventions that's aiming at mitigating the commercial and structural influence of those commercial actors, such as the big food and beverage industry, in driving the NCD pandemic. Marketing is another aspect, and it's very closely aligned with front of package labeling. And in South Africa, there's been strong efforts to try and particularly look at the marketing of food and sugar sweetened beverages to children, and that's aligned with front of package labeling. In fact, just recently, if I'm not incorrect, Mexico had produced legislation that almost renders it illegal to, in fact, sell sugar sweetened beverages to children. So they've really gone at it in quite a significant way. And there's many parallels to the work that we've done in South Africa around tobacco, for example. So, with that kind of backdrop, it's a real pleasure to welcome Petronell Kruger, who is the person on the left-hand side with the glasses, and Mikateko, who you can see next to her with the white jacket. And both our colleagues, Petronell and Mikateko, they both with a legal background, both lawyers. Petronell has a particular interest in the interplay between human rights and public health, and Mikateko has a particular interest in policy and the health aspects of policy. So they also have with them Darshan Naidu, apparently just recently joined Priceless, Darshan, so very, very welcome. So to all of the colleagues from the School of Public Health and elsewhere, and now to our Priceless colleagues, a warm welcome to you. And I will now leave the presentation over to you, Petronell, and really very much looking forward to it.
Oh, thank you so much, Maylene. And to say, I like the fact that we're a more intimate group. So if anyone has any questions, please feel free to just unmute and ask your question. It's likely that I won't be able to see hands. And also just to say, I did see Tamron on the call earlier, but she might have joined with Rena Swart, who's on the call. And this presentation was developed by myself and Tamron, so you'll see that the UWC logo there is on the right-hand corner. And another key partner, just to mention, is Makoma Bupape from the University of Limpopo, who's done a lot of fantastic backdrop work on this front-to-back labeling. So today I'm going to share a presentation that we previously shared with some of our advocacy partners on the current proposed front-of-pack labeling regulations that the Department of Health has published, and which the formal commenting period has ended on, and we'll have to watch that space to see what happens next. But really want to take you through, firstly, how the front-of-pack label is situated within our overall legal context. And let me just switch off my camera. Our internet is a bit weak on the side. And then talk in very, very broad strokes about the label, and then talk in a little bit more detail about the marketing restrictions that is proposed to accompany the label. And to say that just because I'm not going to go into heavy detail on the actual label and how it's determined what foodstuffs will carry the label does not mean that it is not of absolute importance. However, a little bit of a teaser, Tamara Frank will be presenting that work in more detail, I believe, quite soon. So you'll definitely get the whole view of this regulation. And for everyone in the audience, because it's not always the state that people understand sort of the legal process and what the status of documents is, I thought it might be helpful to just reflect on what is the difference between a regulation and a law, which you may or may not know. But effectively, this little cartoon here at the bottom is quite helpful. And the idea is that in a constitutional democracy like South Africa, where we have an expert legislative body, or so we're told, at least in parliament nationally and then provincially and locally, we have a dedicated state arm which makes laws. It also is then important to note that, firstly, people who sit within those bodies aren't necessarily subject matter experts. And secondly, just really do not have the time to be regulating on each and every issue. And that is exactly why something like this labeling restrictions, or the labeling and marketing restrictions, will be situated in a document like a regulation, because it does require this expert insight that Parliament, for example, would not have to the same extent. And what's helpful when thinking about regulation, we call it delegated legislation or subordinate legislation. But think about Parliament as having a cup of water or a jug of water, and in the jug is Parliament's power. And the water is really prescribed by the Constitution. So the Constitution will say Parliament has the ability to make laws on A to Z issues. So that is the water. But because Parliament does not necessarily have the ability to get that water everywhere, Parliament will start pouring some of that water into smaller cups and allowing other officials to then exercise small bits of Parliament's power. And the reason I think it's helpful to think of it in this way is because the water in the official's cup can never be different than the water that Parliament poured into it, and it can never be more than what Parliament had. So it's very important when we think of regulations like this that we also put it in the context of what the actual legislative authority is that was given to the Minister of Health. So the legal framework for this front of pack labeling regulation falls within the Foodstuffs, Cosmetics and Disinfectants Act, which very broadly says that it entails to control effectively how we import, and we're really focused on foodstuffs here, sell, manufacture, and then it says broadly for incidental matters, which is just a nice way for Parliament to try and cover their own behinds. But effectively, why the labeling and marketing restrictions will fall under this particular act is because we've seen that this act has been used to regulate labeling on other matters and on foodstuff, and B, we've also seen marketing restrictions being implemented. So what is the structure of the regulations? What's being proposed? Well, it's a mammoth document, which, depending on your level of interest, can keep you awake the whole night, but also depending on your appetite for legal jargon, could be a potential solution for any kind of insomnia that you've experienced. And I'm not going to go into all of this, but just to say that when we're talking about the front of pack label and the marketing restrictions that accompany the label, that really is one component in a lot of issues that these regulations purport to regulate and to change. And it is quite a significant document in the way it will change how we label and describe food moving forward. And I would recommend anyone in the food space at least have a passing knowledge of just the sort of general restrictions and changes that is made here. I'm not going to go into all of this. I've included it in the presentation, again, with the thanks of Tamara and Frank, who, for example, developed these slides that I'm looking at right now. So please feel free to review the slides after the fact for more detail and to use it as an ability to navigate this document, which is published on the Department of Health's website. So what is a front of pack label? I'll show a picture now, but effectively what we have in South Africa is back of package labeling and then some restrictions on what you can place on the rest of a container or a package for food. And that is inaccessible. So the idea is, and we've seen it being pioneered in several other countries, predominantly our South American colleagues have been doing quite well in implementing this, is that on the front of the pack, where the consumer actually makes the decision to purchase a product, there will be some kind of interpretative tool to assist the consumer in understanding whether or not something is healthy or unhealthy. So in South Africa, we're proposing a warning triangle, which Makoma that I mentioned earlier has actually tested. So we have local evidence that suggests that this is the most helpful. And if goods meet certain criteria, it will have to carry various different labels. So it will say this good is high in sugar, this good is high in fat, etc. But for a good to carry this label, it has to be something that's packaged. There has to be added sodium or saturated fat or non-sugar sweetener. And there are certain thresholds, which again, I'm definitely not equipped to give detailed comments on, but to say that Arena Swart and Tamara Frank and the team worked extensively to provide the local evidence required to assist the Department of Health to ensure that these thresholds presented is evidence-based and is actually assisting consumers to make decisions on whether or not goods are healthy or unhealthy. So if those requirements are met, we hope to see very soon that the front of pack of those products will not be as healthy as other products and who is packaged will contain one of these warning triangles. And importantly, and what I want to talk about today is that once a product does carry this warning triangle, there are restrictions on what can be done with the product and how the package can look and what kind of claims can be made, and then on the marketing and advertising of that product. So very importantly, the regulation says, as in line with the WHO set of recommendations on marketing of unhealthy foods and beverages, that unhealthy foods, which the assumption here would correlate to products that carry this warning triangle, cannot be marketed to children. And we'll talk a little bit about why that's very broad and about the details the regulations then go into. It cannot carry a health or nutrition claim, and it cannot carry other endorsement logos. So why are we excited about the restriction specifically that says that goods that carries a front of pack label can't be marketed to children? That's because it's absolutely evidence-based at this stage. We've seen several studies that indicate, firstly, that children are targeted for unhealthy food and beverage marketing. So other colleagues at UWC have done audits, for example, on radio adverts and television adverts and newspaper adverts, showing that the kind of marketing of food and beverages, firstly, is, depending on this study, 50 to 60% unhealthy food. So we know that what food is being advertised, things that are bad for us. And secondly, and very importantly, that those foods are more often than not marketed in such a way that it's designed to appeal to children. And I always say that this is actually a moral issue. It's of course it's a health issue, but the moral issue here is the idea to manipulate children into purchasing goods that is unhealthy has been normalized. And we actually see that today, where the types of comments being made on marketing restrictions of harmful commodities to children will face challenges such as kids over 12 don't qualify for certain protections, and a fair amount of red herring arguments that purport to rely on the agency of children, but is actually just a way to mask the fact that we do know that children do struggle and up to certain ages have an inability to distinguish between commercial speech and normal speech. So they don't understand when something is designed to be persuasive. They view it as truth. So puffery or descriptive words like "this is the best cereal in the world," it's certain up to a certain age, and I mean, it differs from child to child, will be deemed as truth. And then even when that ability does kick in to draw that distinction, the ability to act on that knowledge is, of course, more difficult for a young brain. So in law, we call it cognition and cognition. So the ability to understand and act, and then the ability to act on that understanding. And in all other aspects of regulation, we understand these facts about children. So it is quite interesting that when it comes to marketing, we have not yet taken the necessary steps, at least in terms of the
Petronell,
food sector. Yes,
thank you. Based on your kind invitation to ask questions
please.
as we're going along, so there is a question here asking whether the marketing ban extends to internet and social media as well, or only the traditional TV and print and billboard media.
That's a fantastic question, and the answer that it extends to any marketing activity, so it will extend to any medium, because the way in which advertising is set out in the main act, the Foodstuffs, Cosmetics and Disinfectants Act, is that it's effectively a broad description saying that products are being communicated to consumers in certain ways to persuade purchasing. So
Thank
it
you.
would have far-reaching consequences. However, there's a very important distinction to be made here. Just because this proposed ban will cover all media does not mean that the structure to implement the ban will be able to firstly monitor all media, and secondly, that sanction powers will be effective. So a really important thing for us to think of, especially as a country that is not high income, is when it comes to, for example, social media algorithms. We won't have the ability to regulate companies like Facebook and Alphabet, which is Google's incorporated name, or the new X, which previously was known as Twitter. Firstly, because those companies are incorporated in other countries. So we'll have to think about a way in which we can actually firstly ensure that children are not being targeted. And that probably at that level will not be done under these regulations. And secondly, how we go about exercising that sanction power. A really good way, and it actually links to the slide that is proposed in this regulation, is to target the party that whose product is being advertised, so the food producer or food business operator, and not to target the media company. And that is something that we can obviously do, and we already have that infrastructure because we already have restrictions on how products can be labeled. Whether or not that's sufficient, I will leave to everyone's imagination as to whether or not we're effective in this large endeavor. But we have done a separate study, and there is serious concerns about the ability of the government to exercise its power under the Foodstuffs, Cosmetics and Disinfectants Act.
Thanks, Petronell.
Absolutely. So earlier I said, it's quite a broad term. What, you can't market to children, but what does that mean? Well, the regulation does not attempt to describe what marketing to children means, but it does go into a subsequent regulation which sets out marketing restrictions generally. Now, these marketing restrictions, if you read it content-wise, is actually aimed at curbing techniques that is deemed child-directed, but it could be interpreted as more broadly. So it's techniques rather than exposure-based. So we're not trying to measure who's actually viewing the ads, but rather we're trying to measure the techniques or to limit the techniques that we know would be more likely to impact children's ability to decide to purchase healthy foods. So what can a product with an FOPL front of pack label not do? And this is quite contentious, but very important and evidence-based. It cannot use celebrities, animations. I don't know why I said sports star animations, and sports stars. Now, there's a reason there's a distinction between the celebrities and the sports stars. Firstly, the use of sporting celebrities to market unhealthy foods and beverages, and I would say actually particularly beverages, is quite well noted. And secondly, I'm emulating the wording used in the regulation, because there definitely will be some issues about the interpretation. And we hope that when the regulation is passed and formally a regulation, that some of the wording issues will be resolved, because there is some potential for problems around that. And you'll see in brackets underneath these bullet points, I've mentioned a few countries, and that's really just to say that these are the countries where the wording we use in the regulation most closely links to wording used in regulations in those countries. It's not an exhaustive list, but it's where we really find that we have almost identical wording on our own regulation. And this is very important because we want to show the Department of Health, firstly, that this is doable, And secondly, that they're actually following international health trends and that they can look to those countries to consider how they tackle things like implementation, and then the monitoring and evaluation and sanctioning that needs to go with that implementation. A second very important element, that if a product carries a front of pack label, it cannot contain a token, gift, or collectible item. So really inspired by sort of the traditional Happy Meal toy that you would get. And that has been something that the food industry claims they're not doing because of voluntary regulation. But audits have shown that that's still quite pervasive. And then we reach the slightly more difficult to navigate language. The regulation says that products with a warning label may not abuse positive family values, such as portraying any happy, caring family scenarios. This is probably a little bit difficult to implement, and the department can probably think about rather just having a restriction on depicting just young people in general, which they have introduced in quite clumsy wording. So that's quite difficult. And then it says you can't encourage excessive eating or overly large portions, which we've seen in countries like Portugal and Chile being introduced in marketing restrictions. You can't undermine the promotion of a healthy diet. Mikateko is on the call, was actually recently doing an audit of sort of COVID messaging. And we found an advertisement from a fruit juice company saying which one contains vitamin C, and then held water and juice, and effectively said, if you want to beat COVID, you shouldn't drink water, you should drink juice, which is absolutely wild and a fantastic example of where this kind of regulation would apply. You can't encourage inactivity, which is a little bit strange that we phrase this like that, because other countries usually say, you can't encourage sedentary behavior, but effectively it will have the same result. You can't mislead. And I say that this is a duh because we already have the Consumer Protection Act. So misleading misrepresentations are actually already regulated and covered in quite a lot of detail. You can't represent your product as a substitute meal. And then a little bit more difficult is you can't create a sense of urgency. A very good example of how this restriction would apply is when it is something that carries a front of pack label and says you have 2 days. If you purchase this, you will get a second one free. And that definitely would cover that sense of urgency. And I don't expect anyone to try and read the table I have on the screen in any kind of detail, but just wanted to give a snapshot, especially with the countries represented in the left column, of how broad this introduction of marketing restrictions is actually represented worldwide, and what kind of elements of marketing techniques have actually been either reduced or limited. The regulation does not cover infant formula milk, no. So you can see we have representation really from across the world. In terms of the marketing restrictions, I just want to confirm this is for the marketing restrictions. This is not for the front of pack label. So these are marketing techniques, and you can see it's been applied in quite a number of countries. And in some countries, regulations like this have been active for 50 years. So this is not new and novel, as industry is attempting to convince us. So what do we like about this regulation in terms of the marketing restriction? I mean, we like that it exists, firstly. That's wonderful. So that's great. We like the fact that there's this limitation on premium content. We like that it shows quite a broad understanding of practices that we should try and limit. And what I failed to mention is that if a product carries this label, when it's being advertised, there needs to either be a visual warning or an auditory warning if that's the media in which it's being advertised, relating to the unhealthfulness of product as well. So even if it doesn't do any of those restricted category of techniques, it doesn't employ those, it still has to be coupled with this warning message which is actually a fantastic inclusion and goes beyond what most of those jurisdictions I've shown in the previous slide has done. What would we like to see? We would really like to see restrictions of marketing in settings where children gather. And this is something that there's a lot of precedents for in those countries captured in the table. So, of course, this will include school environments, but this should also include sporting and cultural event centers where children would go and attend events. It should include health facilities where children are likely to gather. So there can be quite an expansive reading on how to regulate this. And that can be quite complicated to regulate because you'll have to have various government departments involved. When we made the slides, this was not included, but I'm very happy to say that in the regulations have been published 3 times. In subsequent regulations, there has actually been an inclusion that says that those goods carrying a front of pack label cannot depict children or young adults. It's not worded fantastically, I will say that, and it does cause a bit of confusion. So we hope that's rectified in the final version. But this, again, has lots of precedents, and the World Health Organization, again, does set out that this is quite a good indicator that product is child-directed, and because children respond quite well to seeing other children. And again, with an audit we've done, especially high sugar energy drinks, try and get around this by depicting young people where they're not children, but sort of in aspirational settings, so at university level, performing well in sports. And this is also a way in which to effectively convince children that there's some type of inherent character win when you ingest their products. And then we'd like to see even broader restrictions. So what some countries do is they put a reverse onus. So they would say that if you advertise food or beverages, for example, on television during certain hours, the onus is on the company to actually prove that it's not child-directed, and they will set out a fairly broad test. So you would factor in additional things like the use of color, the use of additional photo elements, the use of certain kinds of songs, the use of language that would be deemed to be appealing to children. So, for example, employing a slang or employing material such as referring to TikToks, using influencers in your product advertising. And this, again, thank you so much to Tamarin, who made this fantastic slide, is just a depiction of all of the evidence that has gone into from South Africa. And sure, the under review slide needs updating, but we know that the current regulation is actually very well supported by evidence. So that argument sort of goes out the window. And I just want to make one comment, Maylene, and then I'm going to be quiet. So
Sure.
it says here why you should comment. The commenting period has ended, and we'll need to keep our eyes open to see if that's actually the case. But just to show, when we reviewed the public participation period for the sodium restrictions and for the SSB taxes, we really saw that the majority of the voices in the room is industry. And then, of course, the industry voices talk about the for-profit motive and introduces false evidence. So there's a great paper by Sachs, Fuchs, and Swinburne where they analyzed, for example, during the South African health promotion levy, the misuse of evidence that was presented by industry and industry associations, which effectively amounts to fraud. So it's important for us as members of a non-profit independent space to be involved in these participation processes so that we can counteract these narratives and also make sure that the department understands that the real public opinion does not reflect what these well-resourced industry players say. Fantastic. And with that, I just need to exit. There we go.
Thank you so much, Petronell, for that really thorough and insightful overview of where we are at with front of package labeling. And I think you very succinctly gave us an overview of the complexity of the policy and legislative environment and the strong voice of industry in it, and where we as public health researchers and academics and our counterparts in civil society can bring our voices to bear. You've also very nicely, I think, gave us an overview of how important context is, and we have to think about what it means within our context. You've also given us a strong sense of how important it is to understand the variety of actors that are at play in this space. So thank you very, very much for that. And I just quickly Googled the Gazette, and it's a 238-page gazetted document that people have been commenting on. So here at UCT, as far as I am aware, the Children's Institute on behalf of the Red Cross, well, not Red Cross specifically only, but the advocacy committee that started out at Red Cross Children's Hospital had made a submission, and many of us had contributed to that submission. So there's always opportunity for us as academia and researchers to give input in these processes. So thank you very much. And it's now open to questions. And I see there's a hand up, Natasha. So Natasha, you have the first opportunity.
Fantastic. Thanks, Melia, and thank you very much for the really great overview. It's a policy document I think we've all been looking forward to, and hopefully it gets past all the review. Just some background. I'm a public health clinician from the city of Cape Town. And so this is of particular interest to us because through environmental health, these kind of regulations fall under part of the remit of the environmental health, and we have a food unit at City of Cape Town, which mainly focuses on food safety. And so, but I have a few questions and a few comments. So the one question is based on environmental health and this legislation and the labeling. Would enforcement of this labeling fall under the mandate of environmental health? Do you know that? And then secondly, you speak about the shortcomings of the policy. And it's a very interesting space for me as well, because at the city, we're looking at policy at a municipal level that we can implement to promote healthier lifestyles and healthier living. And obviously there is a lot which is in our mandate, and there's a lot which is not in our mandate. It often comes down to us kind of manipulating our mandated activities to manipulating policy to fit our mandated responsibilities. So we've been chatting about, are there opportunities for us to restrict advertising of either alcohol or unhealthy foods or something like that in certain spaces that we have mandate over? And for example, there's been some restriction on advertising of junk food in Manchester, in London, sorry, and then they're extending it to Manchester now. And so, not that we're doing that, but these are the things that we've been discussing. So I wonder if there is space, for these shortcomings that are in the policy currently for other levels of legislation to maybe address these shortcomings. So perhaps at a municipal level, we could consider, more restrictions around places where children are, such as schools, etc., etc. But yeah, thanks very much. Really interesting.
Yes. Thank you very, very much for that. Those two questions, Natasha. And just to say to the colleagues, the City of Cape Town has been involved in some really I think, groundbreaking policy making, especially around the climate change and urban resilience space that Natasha's been part of. And I'd urge colleagues to perhaps look at the City of Cape Town website. It's really been a wonderful example of really beautiful policy making. But of course, it needs to be translated further down the line to some of the detail. So, Petronell, you want to respond, you or your colleagues, to those two questions?
Absolutely. So, my response to the first question is very simple. I don't know. I suspect not. So the implementation of the regulation, so any regulations made under the Foodstuffs, Cosmetics and Disinfectants Act will technically be done through a vehicle at the National Department of Health. We've seen other regulations not operating in that way, and that hasn't been formally included in government gazette. So I won't comment on whether or not that's permissible, but it is effective. So I don't know. But to talk a little bit about what are some of the missed opportunities, I think it's very interesting that you're coming from a local government perspective, because actually I think there is quite a massive opportunity for local government to step into the role of regulating the outdoor advertising space. So, with the WHO, they're currently making quite a lot about social media. But the reality is, Ornico, which is this company that sort of audits the marketing space, we still see a significant, and when I say significant, I'm talking a majority of the spending of companies is in the outdoor advertising space. And unlike other countries during COVID, we found that advertising expenditure, it doesn't make any sense, but then the outdoor space actually grew. So we really see food and beverage companies doing a lot to ensure that in the outdoor space, on transport corridors, especially to schools and close to schools, that these unhealthy products are being displayed. And it's been a few years since I've looked at your bylaws. I'm pretty sure currently your bylaws do not permit, so the City of Cape Town's bylaws do not permit such a detailed content review. I believe most municipalities in the country really effectively only review outdoor advertising to ensure that it's not offensive. That usually means that it's not some sort of depiction of nudity, or an overt reference to sex, or that there's racism involved. But the reality is, this is a space that, if you change bylaws, you could actually do quite a lot. And that would be lovely, because that would also give an alternative mechanism for concerned citizens and advocates to actually lodge complaints and to ensure that there is some sort of sanction power that's involved. How effective local municipal sanctions are in terms of outdoor advertising is a separate question, because of course it's quite resource intensive, and if companies start taking the municipality on reviews for those decisions, it can actually become quite difficult. So that's something that will have to be tested or piloted at this stage. But I think it's very interesting that the City of Cape Town is thinking about stepping into some of these gaps, or and I'm not saying committing to it, of course, but just thinking about how the food environment more broadly can be looked at, and using some alternative mechanisms. I think something that's very important for us when we're looking at marketing restrictions is to note that this is one of those policy areas that you cannot regulate using only one instrument and using only one department. It is inherently something that will cross various sectors and various spheres of government. I mean, because you effectively need to have context-specific ideas of what to restrict and ban. So that means some subject matter expertise on the product that's being marketed. So in the instance with food, that would be health. But you also need to move into spaces of trade and industry, because effectively also looking at companies' intellectual property rights. And you need to look at digital communications, because you would need to have some sort of check and balance in place, or at least a monitoring system where you review the media sources. I hope that answers your question, Natasha.
No, most definitely, and yeah, it would be great to engage on this further offline.
Thank you very much, Natasha. And it also links back then to the question that Maria asked earlier. So I think in the chat, Tamrin, and thank you very much for joining us, Tamrin. So Tamrin says, to add to Petronell's answer, we understand that as per the Foodstuffs Act, that the environmental health officers will be responsible for monitoring, and they've addressed some of the written challenges about this in relation to salt or sodium regulation. So thank you for that, Tamrin. So are there other questions? Because I've got a question of my own, Petronell. Very quickly, you've mentioned now that these efforts require essentially a whole of society response. And I think the City of Cape Town, if you look at their policy documents, they very much try and draw in multiple departments and sectors in their policy-making endeavors around climate change and urban resilience and so forth. So I just wondered, given that there's been a partnership between the Department of Health and Education around integrated school health programming, has the Department of Education in particular made any commitments in this regard? Because I drive past a number of schools that have big billboards of McDonald's or Kentucky's on their premises. That's clearly been funded possibly by those companies. So has the Department of Education come on board with this in any meaningful way?
That's such a good question, Maylene. The short answer here is no, we haven't seen any formal policies being interacted that would meaningfully address this issue. So one of my colleagues, Agnes Aja, and a variety of other members of the team did an audit, for example, of school food environments, and found that 1 in 3 schools had some form of depiction of sugar-sweetened beverages either on the school gate or close to the school gate, school sponsors. And even if you go to the Free State now in Bloemfontein, you'll see that McDonald's is effectively funding or sponsoring all of the school transport in the high school arena. So that has, we haven't seen movement, but we have seen the Department of Health, of Education, apologies, reaching out and in partnership with UNICEF, looking into ways in which they could potentially have some policy intervention in this space. And we are quite optimistic that the department is aware of the issue and is looking at how they can address the issue. But so far, it's discussion, and of course that makes sense because the department will have to firstly show that they're not intervening sort of into the functional areas of other government departments, and that they're not clashing with broader legal infrastructure. But also they'll need to show that it's evidence-based, because most of these interventions can be quite expensive to implement. I mean, a marketing restriction shouldn't be expensive. And if you have a complaints-driven initiative, you can remove some of the monitoring and evaluation expense. But there would have to be some kind of 5-year whatever review to ensure that there's not just general public apathy. And the reason I say that is the Advertising Regulatory Board has a food and beverage code. There's a voluntary code, so that's definitely not the policy ask that we are asking for. But we haven't seen, for example, the public complain using that instrument. While we see right now sort of consumer complaints on issues being again informed by sort of religious undertones, apparently the depiction of Satanism is a really big issue for most of the public. And again, depictions of nudity and offending people. And then, of course, after the whole Click saga about 2 or 3 years ago, we've seen quite a number of uptick on complaints about racism. And surprisingly, interestingly to learn, lots of people complained about where the South African flag is depicted for some reason or another. But what we haven't yet seen is real knowledge from consumers that they can complain. I don't think it's that people do not want to complain. I think people firstly need to understand that this is something that is within the realm of them complaining about, and they need to have an ability to assess what they need to complain about. Something like front pack label, which can help the consumer at least understand firstly that something is unhealthy, really would go a long way. I see here's a comment from Maria. What kinds of pushbacks can we expect from industry? Lessons learned in countries where similar regulations have been implemented. Well, we've actually already seen industry starting to push back. The industry narrative at this stage, unsurprisingly, is that it will magically be very cost intensive for them to add this label and to change their marketing restrictions. I mean, we know that's complete nonsense because they have to print their labels in any way, so just changing a design. And we know how responsive industry marketing is to real-time events. All you have to do is look at a Nando's ad. So it's quite easy for industry to pivot their messaging and change their messaging, but this has been said. And there's been a bit of a hoo-ha that this will impact trademark portfolios of industries because of that depiction of certain cartoon characters. Again, this is not, something that industry should have been doing to start off with, but they're making a little bit of fuss about South Africa's international trade obligations. And we've seen the World Trade Organization's committee receive these complaints, review it, and find in favor of countries that implemented these measures. So that shouldn't be effective. And then finally, industry's favorite argument is to say they'll regulate themselves. And there's, just a breadth of literature that shows that that's ineffective. So but I think we're going to see significant pushback on this, especially in relation to these marketing restrictions.
Thanks, Petronell. So there's many parallels of what you've just spoken now and in relation to Maria's question to what happens around gun control, for example, tobacco control, alcohol control, which we haven't gotten anywhere significant yet in South Africa, and now issues around food and healthy food availability. So some of these industry players are multinational players that operate all over the world, such as McDonald's and KFC and so forth. And yet there is somewhat an expectation from WHO that these things are tackled at individual country level, where some of the countries simply won't have the resources to fight these big industries. So what are some of the global efforts that are made at the level of the World Trade Organization to try and put trade restrictions in place for these multinational global players that operate in almost every country in the world, such as the Cokes, such as McDonald's and so forth? Do you have any idea?
Yeah, Maylene, I unfortunately do have an idea because I don't think we're going to like the answer. So a very important thing for us to remember is that international trade and investment law is really based on the idea that trade liberalization is the default goal that we need to achieve, and that the freer we can trade, the better it is for everyone. And there has been measures. So we've had discussions, the Doha discussions, for example, on public health limits. And I'm sure anyone who's followed intellectual property issues during COVID saw exactly how restrictive some of these trade practices can be and how difficult it is to circumvent it, even if you have significant country support and really clear public health reasons to try and ensure that you have exemptions. Again, I don't think trade obligations here is a legitimate restriction, but that doesn't mean that companies are not going to try and convince governments that it is. So there's very little being done at international level on this issue. And it's a pity because we saw the Framework Convention on Tobacco Control really being a fantastic document to assist with both labeling and marketing restrictions in the tobacco space. And, it's very interesting that you talk about these parallels, because even now we see with sort of the electronic cigarette devices that the department wants to regulate, we're seeing actual frequent industry campaigns are against the proposed regulation. So it is fighting a behemoth, and it is very difficult. The most effective way in which this will be done is if the countries in which these companies are incorporated have stricter controls. Of course, those countries have absolutely no incentive to have those strict controls, because they effectively are extracting wealth from other countries and outsourcing their environmental and health impacts. So what the US tried to do with limited success and in the climate space, some interesting lawsuits that have been started, is they have a piece of legislation that shows if a company violates rights in other countries, that you can actually sue that company in your own context, so within your own country, and then they would implement the sanctions in the United States. But we've had a string of interesting, so the I think it was the Kulamani NGO that actually initiated lawsuits in the US against companies that, for example, supported apartheid, and those lawsuits were not successful. So there's sort of a limited sense of how far you can take it. Last comment on sort of holding international companies responsible is, disappointingly, we saw that several legally, I'm alleged, several alleged, but I believe it's definitely so, that several alleged child laborers, forced laborers, and even unpaid laborers or slaves in Cote d'Ivoire sued Nestle in the US for the use of their child labor practice, or child slaves, child labor. And there, the case was thrown out based on technical grounds. And I'd just like to point out, if anyone from Nestle is listening, they have themselves, with their new cocoa plan, have said that they have no way of ensuring that they can remove child slavery from their supply chain. So don't sue me, Nestle.
Thank you, Petronell. So we've got like 4 minutes left in our call, and I just wondered if Tamarin or Darshan or Mikateko wanted to make any final quick comments based on any of the issues that were raised.
I think Petronell did a great job. Don't have anything specific to add. I have been invited to present at the Confounders Journal Club on the 6th of September. So I will be speaking a bit more about the research that went behind developing the nutrient profiling model and front of pack label in the regulation, if anyone's interested.
Wonderful. Thank you, Tamarin, for that. And we look forward to seeing the linkages with your presentation to this one. Thank you, Lucy, for your appreciation. And just for the Priceless colleagues, Lucy Gilson is the head of our Health Policy and Systems Division, who is the presenting division for today. So colleagues, on that note then, thank you so much to the Priceless colleagues, Petronell, for your presentation, and for Mikateko for your support of the presentation, Darshan attending, and also Tamarin, who's obviously instrumentally worked with you. And I think just as a final conclusion is I think, again, emphasized for me how important context is and how many contextual issues we need to consider in our situation. And also just to urge us all that we have a voice and we have agency. And when we're dealing with issues such as this, where industry is such a powerful and a present voice in these legislative processes, that we need to proactively be ready to counteract the influence of industry, which is not easy, but which Priceless has in particular, and our colleagues at UWC done so successfully and so consistently in this particular space. So there's lots of appreciation for the presentation in the chat. So again, to our Priceless colleagues, thank you very much, and we look forward to to seeing how this particular piece of legislation and hopefully the impact on creating healthier food environments for children, adolescents, and citizens in general progresses. So thank you so much, everyone.